My name is Siddarth Kakodkar. I'm a cardiac electrophysiologist. I work at Methodist. I go to both hospital sites in North and South Lake campus. My clinic is mainly in South Lake. The main reason that drew me to cardiac electrophysiology is just it's a relatively new specialty within cardiology with the focus of actually curing arrhythmias, which is different from some of the other fields in cardiology. And also just the technological advancements that have come through with cardiac electrophysiology. It's grown significantly. And any physician who goes into practice wants the ability to actually cure a patient of what they have versus treating them long-term with medications and kind of seeing them get worse over time. This is a potentially curative field of medicine. And so that's what attracted me to it. So Methodist provided a great opportunity to build a practice here because we have a state-of-the-art electrophysiology lab with dedicated nurse and staff that only do cardiac EP. So it's one of the unique things about this hospital in particular. And so that allows us to really bring the most advanced technology on how to treat these arrhythmias. In fact, we just have acquired something called pulsed field ablation, which is the newest way to do ablation therapy for atrial fibrillation. And we're the first hospital in Northwest Indiana, as well as one of the few centers in the Midwest that has it already. And that's the kind of quality and level of care that we want at Methodist for our patient population. Patient comes first. That's always going to be the main philosophy. So when I see a patient or family in clinic, I always tell them they're eventually going to be the final decision maker. I'm just a guide going over all of the potential options and therapies that we can provide, but in the end it's their decision, whatever is comfortable for them. There are multiple ways we can treat atrial fibrillation, and the number of therapy options has grown over the last 5 years. And now it can be as simple as being on a medication to try to control it versus doing an ablation procedure to potentially cure you of it and maybe get you off of some medications. So some of these procedures can be complex with everything that's involved, but that's the whole point, is the education part, teaching the patient what these procedures are and then helping them come to their own decision for what's best for them. Nice thing is with our advancements, a lot of these procedures are efficient, much safer now, and they go home the same day. So over 90% of our procedures are outpatient, home the same day. The most rewarding aspect of being a physician is making the patient feel better. They come into your clinic looking for help. They usually have some cardiac condition, and if there's something I can offer them, I do. And after that, for example, a procedure or medication is there and completed, if they feel much better after that, that's the goal we have as physicians, right? You're trying to make people feel better, live longer, stay out of the hospital. And so that's what guides our decision-making process.